Just going to let a few more people come in and then we'll get underway. Okay, I think I'm just going to get started and I'm sure there'll be more that join us as we get going. So thanks everyone for coming out this evening for our second in the mental well-being webinar series that we've been doing for this club season. And this is on the topic of coping with injuries, pathways to recovery. My name is Emma Gibbons, and I'm the CEO of Volleyball BC. And I would like to start by acknowledging that I'm coming to you today from the traditional and unceded territories of the Tsleil-Waututh, the Squamish Nation, and the Musqueam Nation. And we operate all over BC. We're very privileged and grateful to have the opportunities to play volleyball inside and outside in this beautiful province. But our head office is based in Burnaby, and so these are the territories from which I am speaking today. So, as I have mentioned in previous spiels, for those of you who have attended, we have placed a focus on trying to address some of the mental well-being issues around playing volleyball. Based on feedback from our members and in various surveys, we've learned that it's extremely important for people that we start addressing this aspect as well as the physical development of volleyball. And so I'm very excited that I think this is actually our third year of doing webinars that we are delivering both in person to those of you who can attend tonight, but I probably have a mailing list of about 70 people who receive it afterwards, and then they are posted on our YouTube channel and on our website. So I know I get lots of very positive feedback from people who access them. So without any further ado, I would like to transfer you over to Dr. Shaunna Taylor, who has been helping us with this delivery for the last 3 years. And I will let Shaunna introduce herself to you and get underway.
Thank you, Emma. That's great. I'm so excited to talk about this sometimes really challenging, well, always really challenging topic, which is injuries and how to manage them. So this one is going to be from the perspective for athletes and families. And I'll be bringing some perspectives from my role as the past chair of the Canadian Sports Psychology Association, but also a professor of sports psychology at UBC. But even more importantly, we have two amazing ambassadors for mental health, Derek and Kyla, here tonight, who will also be sharing their own lived experience and also some of their training as well, and all kinds of really great practical lessons to be shared with everyone too. So thank you to both of you also for, I'll be calling on you in a bit and just and having to wing it sometimes when I just throw you the mic. So you've both been amazing, and I look forward to your input. So we're going to, like I said, tonight, hopefully there will be some real tools that athletes and their families can use. And also, I guess to begin, talk a little bit about how we're looking at the biopsychosocial dimension, meaning we're looking at not just the physical aspects of injury, but mental, emotional, and social. They have impacts in all those three realms, and injury tends to go through three very specific phases with another little sort of potential fourth phase as well: onset, rehabilitation, and return to sport. And we know that mental training and having this kind of support, this kind of education, is really important in making sure that athletes emerge stronger with better long-term outcomes in all the phases. So I think doing a webinar like this and getting more information is so key. Like I said, we do have another webinar that follows this one where we'll be gearing it more towards coaches, but this one is for you if you're an athlete listening, or a parent or a family or guardian member who wants to know more about how to support someone. And if you have questions, many were submitted in advance, so we really tried to gear the content to this according to the information that you already gave to us via the, I don't know if it was a survey, Emma, I guess, where you were
It was
asked.
part of the registration, so people were able to
That's
submit
right. Right. So
questions.
prior to creating this deck and this work for this evening, we integrated as many as we could into the content itself. But if you have anything that doesn't get answered, please reach out to Volleyball BC and we can do our best to make sure that you get answers to your questions. This slide here, lots of text on it, but this is just some of the factors, like some of the key factors that affect athletes' ability to cope after they have been injured. So you'll see there's some really important, 5 of the top, I guess, determining factors here that can really affect outcomes. So how supportive that system that surrounds them is, some of the coping skills that they might already possess prior to the injury, the timing of the injury, so when it happens in the season, and maybe even in their life as well, the degree to which they have hardiness, some people call it grit, some people resilience, in managing stress, and then how psychologically flexible they are. So are they able to adapt with these sudden changing circumstances? Have they already started working on to some of those skills? Perspective building, all those factors. So you can see it can really vary according to these as to how that athlete will end up coping. I worked in a sport injury clinic for 14 years. So this was a really big part of my daily, unfortunately or fortunately, my daily environment was helping athletes many times work through sport injuries. So we tended to divide them into 2 different types. So you're going to see acute injuries, and maybe some of you are on here because you've experienced an acute injury. That will happen suddenly while you're playing, or it could be while you're doing some kind of cross-training activity, or it's an injury that happens that we consider to be chronic. And this is when you've been doing the same activity or playing the same sport for a long period of time, and this type of injury crops up. So it's important to know the difference, and that they both have different types of recovery pathways sometimes. Each of these phases tonight, we're going to go through one at a time. And I'm going to talk, and so will my amazing ambassadors, about things that you can do whichever phase you're in. So whether you're in phase 1, which is injury onset, this is right surrounding the acute or chronic injury that's been discovered or it's being investigated. The second one is now you're in active rehab. So now you know what it is, or you suspect you know what it is. You've been given a rehabilitation pathway or specific activities and elements that you need to do for that rehabilitation. And then the third one is your return to sport. So you're now back on the field of play, you're back on the court, you're back in the gym. And what are some things that you can do there to enhance your mental health and coping as well? You'll see I don't call it a phase really, but there are times where athletes do need to transition. Maybe that chronic injury has become something that they make the decision, or the decision is given to them, that they might need to look at a different type of activity. And we want to make sure in the sports system that, at least I do, and I'm sure my colleagues do as well, that there are other really meaningful activities, maybe even other sports that they're able to participate in. So we might build a bit of a sport map or a transition map for them too. But for the purposes of tonight, we're going to focus on the 3 phases that I've got here listed for the main part of our focus for the evening. So we'll start with injury onset. And I think this is where, as the athlete or as the family member, we make sure that we're seeing the person as a whole person. So not just, it's all about an injury right now. It's like, where is this person at? So where are they in the level of accepting it? How is it landing for them? So how do they feel about it? Surprisingly, for some athletes, it's a bit of a relief, because it gives them a rest, especially if it's just a small injury. For others, it's a huge source of anxiety. So phase 1 really involves talking and making sure for athletes that they have someone to talk to. If you're a parent, sitting down and getting the inside track on how your child is feeling about it. Many athletes have a very high level of athlete identity, meaning their athlete self is a really big part of their whole self, right? When they describe who they are, they proudly announce that they are an athlete. That's one of the first things that pops into their mind. So you can imagine that being injured would cause a lot of distress in an athlete with high athlete identity. Also, just encouraging that opening up, encouraging an athlete to know about their plan, to get involved, to get educated, and how they want to be supported. So, all of these things really key in those really early onset stages if you can. It's also important to get the right people around them, listening to their concerns, having that dialogue back and forth. And I just have a little note on here because some of the questions that we had is how do we find a good sport medicine professional? Or where do we turn if we've never used one before? And I would highly recommend that you visit the Sport Med BC website is a good place to start because they are sport informed practitioners. So they are physiotherapists, athletic therapists, sport medicine doctors, et cetera, who have experience in sports. So not just medicine, but in sport. So rehabilitative science that is geared towards the sport context. And they tend to really be, I think, one of the most helpful pool of practitioners that you could go towards. Or of course, there's always a really great community within volleyball and word of mouth of people that your friends or colleagues or other clubs have been using and have good reviews. The second one being emotional and the team support. So staying connected with the team, being involved with team functions. So athlete gets injured and there's a really important team function coming up, like something really fun, making sure that that athlete is still included, that we've got ways to keep that connection whenever appropriate. And also thinking about the short and long-term effects, but also the gains. We're going to talk a little bit about the positive side of injury too, even though it might seem like there isn't one, there absolutely is. And it's really critical that we look towards that as well. I also wanted to do a shout out here for Volleyball BC, who has done a really great job of partnering with, and forgive me, Emma, I don't have on this slide who you partnered with to come up with these great
It
one.
was Kids Physio Group. Mm.
Thank you. Kids Physio Group. And so if you go on the link on their website, they have these are common volleyball injuries where you can see on this one, we've featured, some hand injuries and a rotator cuff, patellar tendinopathy, ACL tears, ankle sprain, shoulder dislocation, lower back. So a lot of really important, so signs and symptoms, next steps, answers a lot of your questions on that sort of what realm is it potentially, right? Get you thinking about what this could mean and then taking it to a professional to get it investigated. So these are a really great shortcut to help families and coaches navigate that. And of course, athletes navigate that. The other thing as well, you want to make sure that you're aware of, and I think a lot of clubs are really great at this, especially in today's day and age versus 15, 20 years ago, is the special mention about concussion and about brain injury. It's invisible injury, right? And it's an injury also that can at times be easily concealed by athletes. So really understanding the importance of the return to play and what to do after a suspected concussion protocol. Volleyball Canada has information on there. You know what, Emma, I forgot to ask and navigate your site if you have a link or do you just
We
direct?
do. We have our own return to play protocols and step-by-step guides, and we also have a player handout that people can look at. So all of those resources, if people would like to access them, are on what we call the Safety Hub, which you can find off our the front page of our website.
Excellent. I figured it was there too. I ran a little bit out of time. So I thought I would do a shout out, chance for you to be able to direct people to the right location for resources. But this is a really important one. And I think we've come a long way as a sector in understanding concussion and brain injury, but it can be complicated and it doesn't have a very linear pathway. No two brains are the same, no two injuries are the same. And that includes brain injuries. So I think it's important that we get as educated as possible for all of these injuries. The other thing I think at this phase of that sort of onset of injury phase is to try to get the athlete to get towards some kind of broader perspective building. So that even begins with the way that we talk about injury. So for example, you're talking about your knee, and not talking about, in my clinic, it was always a rule, we don't talk about your bad knee, right? If your knee is being rehabbed and you're emerging from rehab, or maybe you've had surgery, it's your new knee. Okay, this is going to be your new knee. This is going to be your new and improved, strengthened, highly examined knee. Okay, and so like just watching the language around it. And I know it can be so tempting to jump because our brains search for threats and they search for language that's negative in framing, but it's not helpful for healing. So things aren't happening to you, things are happening for me, right? We're going to figure this out. So the second that we even change such a little word, like it's happening to me, this happened to me, or oh, this is happening for me. It's happening for me and I'm going to figure it out, right? It can even just de-escalate a little bit, spin it in a little more hopeful and empowering language. I also really love, if you've never checked out Players Tribune, this is the kind of place that Derek and Kyla need to be doing some submissions in Players Tribune. I don't know if either of you have read any of the articles in there. They're so great. They're all articles by athletes, which I love. And also coaches too have some amazing articles in Players Tribune. It's free online, but there's a really great one that I use whenever I have an athlete that has a really challenging injury. I get them to read or think about reading Brandi Chastain's. She was an American national team soccer player, and she does a really great job of reframing her injuries and her setbacks in her letter to her younger self. So I'm not obviously going to do an entire essay here, but I thought I'd just give you a quick snippet. We won't read through the whole thing. I'll just give you some of the words that really stand out for me. In her case, it was ACL reconstruction, two of them, in fact, and a meniscus tear. And I love the language that she chooses in it. You're going to be humbled, be patient, listen to your body. This time away, I'll give you a chance to pause, experience what it's like to not be a starter, to not be the one who scored a goal or made an impact. You'll learn to appreciate your teammates. They'll carry on while you cheer from the sidelines, and that you in turn, they'll appreciate you more and cheer you on as you work your way back into the lineup. Also talks about mental and physical challenges of rehabbing you will test your patience. Have faith in those moments. They're going to define your future perseverance. No athlete knows what's on the other side, right? And then talks about how you're going to return a better player, a better teammate, a better person. Learn about the details, training, nutrition, sleep, right? So really pulling out how in tune she became with her body and just how much she loved her sport. All those things got amplified because she got injured, right? So it's one of those things didn't happen to her. They happened for her, not in a way that she necessarily planned or even wanted, but hey, it's life is 10% what happens to us and 90% what we're going to do about it, right? So I love reading that. I'd recommend if you're an athlete or parent listening tonight to go and have a go at it. It's free, open source online, and there are many other great injury essays on there as well. On this slide, finding your people and finding your resources as soon as possible. So I would say finding a mental skills consultant or a sport-informed therapist. So a therapist, someone who is a counselor, who has experience in sport, maybe was an athlete themselves, has that specialized dimension that they're bringing to their practice. That is really key. And there are also some fantastic New York Times bestsellers out there, including this great one is probably one of my favorites. It's called Rebound, Train Your Mind to Bounce Back Stronger from Sports Injuries by Carrie Jackson Cheadle. And she does an amazing job with this book. It's a manual for getting back at it after an injury. So buy this book. And also she hosts a really cool podcast. So all her past podcast sessions are online as well. Athletes can just listen on their phone, get their headphones in. They can not feel so alone. She interviews really special guests that are there to share their story. She herself is a former injured athlete, and that's sort of where her career took off, was her recognizing this really important subspecialty. And these are some examples of the kinds of really great things that she goes through in her book. So redefining success and some goal setting, which we're going to talk about a little bit later. But enough about me. How about our ambassadors? Because we know that they too have their own lived experience. They both had long careers, so they likely had their own maybe acute or chronic or both injuries. I'm just wondering if one of you would like to kick things off, and I'm not sure who, but love to hear from you and your thoughts about injury in this phase, this onset phase.
I can go.
Thanks, Derek.
Um, yeah, I definitely battled with a lot of injuries, especially kind of towards as I approached university. One in particular was I tore my ACL when I was in grade 12, and I think that yeah, just thinking back to that kind of yeah that early onset days and kind of looking at some of the things you mentioned there, I definitely over the course of that injury because it's a decently long rehab to kind of get back on your feet and back to where you were. I did struggle a lot with that kind of athlete identity piece and just sort of lost this sense of who I was, lost this sense of really like mattering. I think like I think I it was, and I can see it much more now. I think I felt it a little bit at the time. Obviously, just like feeling really sad and feeling very lonely, and feeling very much on the outside of things. And I think you just get so used to identifying with being that person, being an athlete, being a volleyball player, that when you lose that, you don't really realize the water you were swimming in until something like an injury kind of pulls you out of it. And so I think that that was like sometimes like the harder part of it for me was just again that feeling very uh, yeah, kind of feeling very alone in that. And that was definitely a very hard time for me, especially at that age too. I was kind of coming out of high school, going into my first university. It was definitely a really challenging time for me.
Did it happen, Derek? Did it happen in season? Did it happen while you were still in season, or did it happen after?
Yeah, what actually happened when I was playing basketball. So I was in the middle of high school basketball season, and then kind of it was also very unknown too, because I think like, that can sometimes be the tricky thing with injuries is you don't quite know what it is. And I thought it was a sprained MCL at first, so then I rehabbed and kind of played through it, and then dealt with the frustrations of getting back on the court and then hurting again, and then getting back on the court and then hurting it again, and then finally like we got an MRI and it was definitive, like, oh, you actually know you did tear your ACL and meniscus. And uh, that I think that was also a really frustrating part of it too, of just this. I remember because I kept hurting it playing basketball, actually not volleyball. And yeah, this one like provincials game where I got really, really frustrated of just like I had to walk out of the game and just felt so defeated.
Yeah.
And yeah, just that sense of like I so badly just want to be out there doing what I trained so hard for. And then to kind of feel like that just keeps getting ripped away from me was really devastating.
Thank you for sharing that. Yeah, that's a really common theme. And hopefully if anybody's listening tonight and has experienced something similar, they'll be able to really sense that same and have that empathy.
Yeah.
Because yeah, it's that unknown and also that identity sudden like fracture that you have. That's huge. Thank you, Derek.
Yeah.
Kyla, did you have something, whether it was similar or maybe a little bit different or
Nothing as bad as Derek's injury. That sounds crazy, Derek. You'll hear some children in the background, so I'll just apologize that right now. But yeah, I had just playing for so long. Of course, there was always injuries like sprained ankles and tweaks of shoulders and backs and knees and all of those things. So definitely things pulled me out of tournaments and games and many times over the course of my career, which I think is also good to note for the younger athletes listening, just knowing that injuries do happen and whether that is a big injury like Derek's, or just, little ones throughout your career, like they do happen. So I really liked what all of the advice, Shaunna, that you were giving earlier about all of those things and the resources that you can pull from, like the podcasts and the books, and like leaning into nutrition, leaning into sleep. Like it is a really interesting time to, you know, learn different things. It's so hard. And again, I didn't have like a really big injury that took me out for months and months at a time. I was more of the chronic injury, which I'm not sure if we'll get into later, but yeah, just it's similar to Derek. Like any of those really big injuries that takes you out of games, takes you out of tournaments, it is so upsetting, and you don't know how and when you'll return. If you're going to be, you know, a couple steps back from where you were, a couple steps back from your teammates. It is hard to see your teammates continuing to bond and have fun and play while you're, you know, kind of taking a step back. So again, I'll just echo what Derek said about that can be really hard and pretty lonely for sure.
That I'm going to lean into you two with the second phase too, when you're kind of in that bumpy rehab phase as well. That's when maybe you can give more detail of that too. I'm going to come back to both of you. Hold those thoughts, because that's exactly, it's one thing for the onset, and then it's another thing once you're in the thick of it and it's taken a while, right? And you're in that sort of bumpy, all over the place rehab pathway because you're just not quite sure what to do next. So that's good segue. Okay, so that's where, yeah, we're into phase 2 then. So you've got the injury onset, which takes a while. It sounds like with you, Derek, it took a while to even know what it really was, right? So it's not like it's like that. We know what it is. An acute injury can happen. It can be misdiagnosed, or it can be, maybe we minimize it because we actually don't have a lot of observable symptoms. We aren't really sure quite what it is. But once we have a pretty good guess, now we can try to have some kind of an injury rehab pathway. And this is where in the book, in Carrie's book, she talks about once you're in phase 2, that injury rehab, your recovery is now your sport. So she kind of wants to kind of rev the engines of the athlete of, you know what, like I'm going to get motivated to do something different. You know, this wasn't the plan that I had set out for me, but this is going to be a way for me to put some of my energies into some areas where I can have an impact on my recovery. And recommending this go far technique. So far, the acronym being feel, accept, and recover. So the first one, we will talk about this in a few minutes, acknowledging and processing the emotions related to the injury. In my ancient era of sport, which was the 80s and 90s, it was called emotion suppression more than anything. It was just like, suck it up, buttercup. That was kind of, and that was, I don't think it was just my sports that I played. I also played basketball too, Derek. I was definitely a basketball. I did feel like I had to warrior through a lot of things, and it's not so wrong to want to be stoic at times, but to not acknowledge everything that you're feeling. I think if you don't go there, what her argument is that you got to feel it, you got to share it, you got to talk about it, you got to find a way to neutralize it, or it'll just keep haunting you, and it'll turn into, she calls it the monster. Are you feeding a monster, or are you feeding your athlete self? And so when you're just suppressing, you're feeding this nameless monster that's holding you back from healing. So feeling is the first one, accepting them, like this has happened. I have to accept to a certain degree, though I might not know exactly what the path looks like. There's an obstacle now, or there's a little bit of a speed bump here. And by accepting it, we're then able to rally the troops around it and get you through it, right? And then the last one, that's when now we're going to do goal setting, and we're going to find a way to get some real solutions. So I like her model of the go far concept. And so the first one being emotions. So the interesting thing that I couldn't have possibly known back when I was 18 and probably had my earliest big injury is that the more that we kind of try to suppress or ignore or even magnify emotions, honestly, they have their own natural course that they run. And sometimes instead of fighting with them, we need to at least identify them first and even share them, experience them, right? Before we can figure out what we can do to help soothe them, especially if they're uncomfortable ones. So I sometimes will use this model with athletes if they just are telling me, like, I just, these waves of emotions. I mean, am I normal? Like, is this, I was fine. And then I showed up at school and walked by the gym and heard a bouncing ball. And suddenly I got this wave of sadness or hopelessness again. Like I can't even look at the gym right now. Like, where'd that come from? And so all emotions have waves. So teaching athletes and making them understand that it's totally normal, and it's actually a really important part of being human to feel those waves and pay attention to them, be aware of them. You see the top part here within the high distress zone. Some researchers call that peak. That's the refractory period. They call it that, where it's we can't even take in other info. It's so powerful. If it's a distressing emotion, it's so powerful. Some people don't even hear, they don't even see when they're in that phase. So the more that we can get an athlete to just be aware of those waves and name those emotions and maybe even make friends with them, we can actually start working towards getting them through a really tough time. So if you got your wave, right? Okay, I'm trying to accept these emotions. Okay, I'm trying to notice them. It's okay. Everyone's telling me it's okay to be disappointed. It's okay to be all these things I'm feeling. Well, what am I going to do? Well, there's a few different options. Maybe you want to reach out to someone if you feel the beginning of a wave. Now, instead of just waiting for it to hit you like a tsunami, you know that whenever you're around the team, this gets really tough. So, okay, let's make sure that we set aside some time after practice. I'm going to talk to someone about how I'm feeling. Could be a parent, could be another teammate, could be a counselor, whoever you think could possibly help you in that moment. So that's one option. Maybe you want to just let that wave go over, right? And then just kind of sit in it for a bit in order to help spur you towards taking action and making another physio appointment or something like that. Or maybe you want to emerge after the emotion and get right down to it and start setting some goals. Use it as fuel. There's lots of different waves to navigate when it comes to emotions, but just to not be afraid of them. I think that's a really important place to start. And this idea that setting goals, motion acceptance being the beginning, and the goal setting being the action that happens afterwards in rehabilitation, this is really key. So the goals, athletes can set some of the goals themselves and families can set them themselves, but I would recommend that they really collaborate with those sport medicine professionals or the people that are helping oversee some of their return to sport. So when they're in this phase, work with those rehab specialists to set some realistic, some physical goals, but there are lots of other type of goals that you can also set with coaches or maybe with some kind of therapist or mental performance assistant. And we know from a lot of the studies, and Carrie talks about this in her book, that goal setting can really be a time to understand holistic healing and actually become more educated. And I would argue even a better athlete, right? Much more educated, more self-aware, paying attention to things that you may never have paid attention to before, grateful for things that you took for granted before. So this is a list of a bunch of different types of goals. Of course, we've got the physical therapy goals. Those probably shouldn't be done alone. Those are done with someone that can guide you. But also, fuel and hydration. Is this a place that you could enhance in order to enhance healing? Absolutely. I think all of us could probably do a little more help, have a little more help in the fuel department. Maybe there's some social goals. There's some friends, or there's some people outside of sport or inside of sport you want to make sure you stay connected with. Maybe you're deciding, okay, so this is a bit of a detour. Now I'm becoming the student of the game. Yes, rehab is my sport right now, but so is my actual sport, going online, looking up new tactics, following along with my team. If this is the kind of thing that's going to help that personality of athlete, then go for it. Not every athlete necessarily will want to do all of these, but at least pursuing some to keep the forward momentum going. Something else to focus on besides just being stuck in your emotions and feeling powerless. And then, of course, things like mental skills. So we'll talk a little bit later about visualization is a really great tool that can be used anytime, anywhere. You don't have to be injured, but it is one possibility, and some different types of visualization we'll talk about in a bit. Or maybe just more balance in your life. You're realizing, wow, when sport was taken away because of this injury, that left a huge void. Is now some time where I could maybe fill that void with other things while I get better. So bunch of different types of goals to think about. The other mental skills, so breaking them out in a little bit more detail here, some of the mental skills development that can happen during rehabilitation. Already talked about emotion management. So befriending your emotions, understanding a little more, the idea of wise mind or middle path thinking. Some of these things we've already mentioned in previous webinars from the past, and I know Emma has them all on the YouTube channel is probably the best place to find them, Emma. But some of these skills were mentioned in the toolkits that were offered in previous webinars, and I'm going to list some of them a little bit later on tonight. But that's another really great skill they can work on. Other ways to support the team. So these could be, you know, a discussion that you have with your coaches or maybe with an athlete core of, well, how can I stay involved? How else could I support my team? Holistic identity, other elements to your holistic identity. And then, of course, I've already mentioned visualization. So these here, breaking out that idea of other roles, these are some, and in our next webinar, the coaches, hopefully we're going to be giving your coaches some good ideas like these to recommend to you, but doesn't mean that you couldn't take the reins and decide that you're going to step up or potentially investigate these yourselves. So reviewing videos, scouting, new plays, maybe you're the social convener for a while, maybe there's some kind of role outside of sport that you want to expand on, or maybe it's your student athlete self. I'm assuming that the vast majority of you are students. So this is a really important thing to be thinking about, these other elements during that big and sometimes bumpy rehabilitation phase. So now, Derek and Kyla, I want you to put your hat on of, it's not just injury onset, but now you actually have an idea of what it is. Either it's acute or it's chronic. What was it like for you in that rehab phase, which I know can be super bumpy? And maybe we can start with Derek, because I know Derek needs to potentially duck out a little bit early tonight. So we'll go first with Derek.
I was kind of hoping to feed off Kyla, but I'll
okay, you want to go?
No, it's good. It's okay. It's okay. No, I'll be right.
I can talk, Derek, if you want. You went first last time.
No, I'll go. Yeah, I mean, I think like I guess like one thing that was just like coming to my mind, I was thinking about when I was in university and some of the things that like helped me, because I mentioned earlier that just that sense of like feeling very alone and feeling very like I was kind of just in this by myself. I think I actually took a lot of peace and comfort in like just sometimes like being around other injured athletes. So like at our university, we had like a physio room where all the injured folks kind of came together, and you just got this chance to kind of see like, oh right, okay, that person's got a shoulder thing, this person's got a knee thing and an ankle, and it was just I think something about that just helped me kind of just feel I don't know, in a weird way, like part of something, like because when you're on the outside of it, you feel like you're a part of this, you're outside of it. And so I think just that in itself, I think, and that sort of viewpoint also helps me of just like recognizing, okay, even if I can't see people, just remembering I'm not alone, remembering I'm not the first athlete to ever been injured before. I'm not the first person to have an ACL injury. I think that perspective of like common humanity, I think is like such an important piece, and was again, I think I can look back and see that, but at the time I just felt it as like, okay, yeah, right, you're not alone. And that was, I think, an important thing in there, and being able to also then just like share with people about that who are also injured. And I think that if I were to answer the question like habits, like I think that would be one of just like not being afraid to like talk about it with people, because whether it's a person who is currently injured or a person who you don't know, maybe they were injured or maybe they will get injured, and there's this like, I don't know, a connection that kind of comes from that.
Yeah, and they didn't have to, I'm assuming, like you said, they weren't all the same sport as you, right? The common
Yeah.
denominator was they were all trying to make it through their rehab together, but together and separately.
Yeah. Yeah. And we're all striving towards these goals of wanting to be better athletes. And I think something you were saying there earlier, just like injuries being inevitable in some sense. Obviously, we don't want it, and it doesn't, preferably would want that to happen, but not being so surprised when it does, and kind of anticipating or just, when things are difficult, not being so surprised when that shows up. And I think having people alongside you in that helps again with the like, okay, what was it? Misery loves company or something like that. There's something I think comforting about that.
Exactly. I was going to say that thing when you were mentioning going into the rehab room. Yeah,
Yeah.
that physio
Yeah.
room.
There was a camaraderie there. We could laugh about it too. And I don't know, just like, oh, you're back again, or just, I don't know, like there was, there's some familiar faces, I guess, in that space, which was kind of nice.
Yeah, I think that's why Carrie, when she called her podcast, Injured Athletes Club, like, I mean, that doesn't really sound like a club that anyone necessarily wants to join, but that's kind of the club that it's so powerful once you're in it, the fact that you aren't alone, right? Like I think she recognized that therapeutic power of being together. So she just kind of created a virtual club so they wouldn't feel so alone. So I love
Mm-hmm.
the suggestion of, really how you seeked it out. So thank you. That's amazing. Kyla, how about you with more sort of chronic injuries that were going on and they were different and they kind of were layered maybe throughout your career as well?
Yeah, chronic was also a bugger because it would just kind of sneak up on you. My chronic injury was a overuse injury in my shoulder. So if we were doing heavy training or it would just, flare up when it wanted to, that was pretty tricky because it feels, as you were saying, Shaunna, like you kind of have this sense of the suck it up buttercup motion in your brain. And it's annoying as an athlete to like continue going to your teammates or to your coach to say like, okay, my injury, my shoulder is not feeling good. I might need to take it easy, or I need to do this. Like no one wants to be, that person, that player that's, taking it easy or it's just there's just so much going on in your brain. So that's like kind of the first, I guess, bump to get over is making sure that you're advocating for yourself when a chronic injury is flaring up. And um, you know, it might happen to other players. Maybe not everyone agrees or has their own opinions, and that's fine. Like you need to take care of your body. Um, I think when, of course, I would always try to do as much as I could. So if I couldn't attack, I was always trying to do extra passing reps, or I was on a court um, doing as much as I could. If I was completely out, I would usually be doing all of my rehab exercises off on the sidelines as well. And for those that aren't, in college or university, if you're more in the club scene, making sure that you are getting again to all of those team events, even in practices, all of the team huddles, you're still contributing as if you were, still able to physically. I think it is a pretty unique opportunity to see the game from an outside perspective. You could be learning a lot just from watching your own teammates. You could be, if you have tape of either games or practices that you could be watching, and if not, now there's an American volleyball league that's really fun to watch. And so you could be watching some of the best players in the world and, taking notes from that. I think staying in it mentally is one of the greatest things you can do, because it's very easy, as Derek and I kind of alluded to kind of go down that rabbit hole, think you're alone. This is my identity. This really sucks. I don't know how long it's going to take, and kind of get into that like depressive cloud. When you're not taking these steps, it's easy to go down that way. So I think, again, just trying all of these things that Shaunna's mentioned, doing exercises, trying to push and elevate your game in other aspects can be like hugely, hugely helpful. So by the time you come back, it might take you a little bit physically to get back to where you were, but mentally you're so much more ahead than you were when you left with injuries.
Yeah, it's a tough lesson to have to learn, right? It's not exactly the method.
Not easy.
Like not even close to the method of why, and the how. How I learned to be a holistic athlete was I had a chronic shoulder injury, But guess what? Like I said before, that old cliche of, yeah, life is like 10% what happens, but 90%. So what am I going to do with it? Okay, I've got this chronic injury. What am I going to do in order to get my way through this? And it's going to be up and down, right? I bet it wasn't all, yay, it's all just an uphill thing for you. You probably had some going backwards as well,
Going
too.
backwards, it was, always hurting. You kind of have to decide when it's okay to push through, when you need to take a step back. So you're kind of just always juggling that every day, basically.
Yeah, it's a flip-flop. So yeah, I think us just talking about that now, hopefully if an athlete or family is watching this, they'll realize, is this normal that I'm feeling? Yeah, it's normal. It's normal. It's going to be bumpy and up and down, and it's not always going to be forward. But hang in there, because every day is a chance for it to change, right? And to develop that same perspective. So thank you so much for that. Your experiences as well, Kyla, about what it's like with the chronic injury. It's a different path than an acute one. So that leads us. So now if we do make it through and we're in rehab with the chronic phase, you're in the kind of constantly going in between rehab and return to sport. And then you might have to go with chronic, you go back to rehab again. So it's this cycle. And it can even happen with some acute injuries as well that are more complicated and require a little bit more nuanced rehab and different directions. You can be going back and forth between phase 2 and phase 3, right? So not to get too discouraged when that cycle happens as well. But for the sake of fleshing out each of the 3 phases, let's talk now of the final phase for tonight, talking about phase 3. So this return to sport phase, this is where often you'll see athletes will have a certain amount of fear, even though they've been looking forward to this, probably for the weeks or the months that it took for them to get to this phase. There can be this overwhelming sense of fear, this program running in the background, that this could happen again, or maybe it's a fear of, I lost time during my play. I'm not going to be able to keep up with the play. I'm not going to be able to understand new tactics that I missed out on, right? So there's lots of different types of fears, whether it's re-injury, underperforming, or I'm going to be behind everybody. This is where we really do want to lean into this idea of injury, being, instead of just an obstacle, it is an opportunity. So this is your chance. You've had some time away. How are we going to use this as a means to grow as an athlete? And one thing that I recommend for all athletes at any stage, whether they're injured or not, is to keep some kind of, or try to keep track of some gratitude of what you are grateful for. And those gratitude entries, some of them, if you log them long enough, they turn into something like the letter to younger self of Brandi Chastain, that it wasn't for years later when she's got journalists prompting her to talk about this long career that included many really difficult injuries, realizing, wow, there was so much gratitude interwoven between and even because of my injuries. So those setbacks can turn into the grit that you later possess. So I think it's something to think about, and it's a perspective to try to bring into with you when you head back onto the field of play. You also might want to be able to really see yourself doing that performance. So sometimes this is not necessarily just a group of injured athletes that I have here. This is a group of athletes of all different stages. Maybe some were indeed injured in this picture, but really using that time before heading out onto the court, it can be a really powerful thing to do static imagery, which was visualizing what you're going to be accomplishing in practice or in that game. Some athletes really use visualization a lot. Others, it's not the strongest tool in their toolkit, but if you happen to be the former type of athlete, this can be a really powerful skill that you can use to increase confidence before you head back onto the field of play. So static imagery is imagery that is done away from the court, and dynamic imagery is when you're right there in the court, you can hear everything, you can smell and see and feel everything because you're right there in the place where you're about to perform, and it's a equally powerful. And there's also imagery for healing. So I do encourage, and when I was working in a sports medicine clinic, we had a ton of models all over the place. It was kind of scary. It's Halloween every day, where you had a skeleton, in the corner, or you had soft tissue in the corner, where I would encourage athletes to really get to know their anatomy, get to know their physiology. This is what that ligament looks like. This is what that joint looks like. And this is what inflammation looks like. This is what we're aiming for, is to reduce inflammation. Or this is a bypass that we're doing with the surgery in order to take this tendon over here, or to add this connective tissue or this rod. And if they're not too squeamish, they can even incorporate healing imagery into part of their journey as well. So it is a very versatile tool. I've got some worksheets as well that I might pass on to Emma that she can upload on the website about how you can do different forms of imagery in order to enhance and even speed up your healing and your confidence as you're heading back onto the court. There's some other ways that you can use healing as well. So you can use it for skills, of course. You also can use it for just coping. So just thinking, okay, I'm going to picture myself, or I'm going to think about what it's going to be like in that very first warm up. Okay. So it's not necessarily seeing yourself in a game. It's just like, I'm just going to go out there, do my thing. I'm going to have fun. I get to be out there with my teammates again. I'm going to frame this as being exciting. This is going to be, baby steps back at it, and trying to view it in a positive light, neutralizing some of those fears. So coping can rehearsal can also be a great one. You see, emotive rehearsal here is just anticipating the emotions that you might be feeling and describing them, and think of a certain situation or scenarios. And even if you don't want to visualize them, just talking it through with someone else can really help you manage them before they happen. We've already talked a little bit about healing imagery, but there's also relaxation imagery too. So this can be helpful when you're going into a physio session, or you really want to make sure that you're going into a demanding gym session or on the court. You don't want to be all tensed up, because you don't want to now have some kind of a additional injury due to compensation, or you trying to make up for the fact that you have some strengthening that you need to do. So you're so tense, and then you end up pulling something else. So being relaxed and feeling as confident as you can, given that it's okay to be a bit nervous too. Visualization can help, or imagery can help in these areas too. So it's not just about skills and tactics. There's lots of different ways you can use your brain to rehearse things that are likely going to happen, but you're going to be okay. So I will pass along these kinds of worksheets to athletes that I'm working with. There's other ways to manage re-injury fears as well. And just a few of them are listed on the sheet here. I've already talked about playing tense, getting new compensation injuries. So relaxation skills, doing body scans where you're just going head to toe, figuring out if there's any sort of tight sections and tensing it for a second and then releasing it, right? Rolling things out. There's lots of ways that your physios, of course, are teaching you prehab exercises to do, box or square breathing, and centering routines. And all of these things we talk about in more detail in some of the mental health resources and also past webinars. So Emma, I know those are on your website and can be accessed. The videos can be, the videos are they open source on YouTube? So they could go onto YouTube? Yeah.
They are, yes. If then we've actually got like them grouped by webinars. So you can go onto YouTube, or as I said, like there is on our mental health and well-being page, we do link them by topic area as well.
So I'm
So we
feeling
can add whatever handouts you've got there too.
exactly. And I feel like these ones might have been included. They were probably in the performance anxiety one and
Yeah.
also the self-care one that we did with Kyla.
Yes.
Yeah.
Yeah,
Okay.
we do have some uploads around these as well.
Nice. So these are some that you can do. And also that, you know, building perspective ideas. We're heading back onto the court, right? And thinking, oh, I've lost so many months, or I've lost so many weeks of doing this rehab and not being here. Apply the good news, bad news, who knows? And you might be saying, what the heck is that? Okay, so it comes from sort of a Buddhist adage, but there are many cultures, I think, that have very similar philosophical views of this concept, which is, you know, it's really all about perspective. If something happens to you, you know, it could appear to be really good news to person X, and it could happen to this person over here, and they could see it as bad news. Or who knows? It could be either way, depending on your perspective. So you could win the first game in a round robin and think, awesome. Okay, that is good news. Like, we are nailing this tournament and everyone's celebrating. And the very next day, you find out that the strongest team in the tournament tanked. And now they are ranked the bottom in your pool, and they're going to be your very first elimination match. And you're like, maybe that win wasn't good news, you know? So it's all about perspective. How are we going to use it, right? Are we going to use anything that's thrown at us as a chance to grow and be kind of a, who knows, let's use it, right? That's, I think, where injury falls in that kind of weird, we didn't ask for it, but here it is. How do we make something, you know, some growth opportunity out of it? So in the return to sport, I mean, that's the thing, Kyla, with your injury, you were probably going from rehab, return to sport, back to rehab, return to sport. What was it like for you? And sometimes, did you feel that tentativeness sometimes sort of as it's really hurting, or it's in a particular phase where it's tough? What was it like for you in that sort of returning back after it's improved a bit? Did you have those fears of it getting worse?
Yeah, especially when you're out for days. Oh,
Bad timing.
Yeah, when it's days and or weeks, like the season is short. So any practice, you know, you feel like you've missed so much. And especially if you're not able to necessarily like be with the team, it definitely, for sure, fear comes into a play. All of my teammates are getting so much better and I'm not there. And, you know, we're learning new skills or learning a new technique or learning new plays. And like, those are the things that you're missing. So of course there's fear that you're not going to be good enough or where you were, or like, there's so much. So I think that, yeah, just, that's why I think it's so important to be doing those extra things when you're injured. So there is still a level of confidence. You know, I've watched some of the best volleyball players play, and you know, your brain's taking that in. I've learned, or I've gotten like nutrition and my sleep, and I've learned how to utilize that, the imagery, like all of these things are going to make you a better athlete. And you might not see that the first practice back that you step into, but you will see that eventually over time, even during that season, especially like the resiliency aspect, or like our last web, or one of the ones that we did before was just managing, anxiety and how to play your best. Like learning to do that is going to be so, so, so beneficial for when you do come back and when you are in those big games. So I think just, committing to that, getting better, even if you're injured, will totally help propel you faster and gain confidence when you are able to get back onto the court.
Right. And I hope that athletes that are listening to this tonight, or maybe parents who are here on behalf of their child who might be injured, really hear that perspective from Kyla, because she's lived it, right? So it feels like this massive step backwards, but depending again, how we keep reminding ourselves that, oh, but I grew in this way, or I learned this, it can really offset some of those fears and some of that sense of I'm falling behind, right? If you're falling ahead in other ways. So thank you for that, Kyla. And
Shaunna, can I just interrupt? There's a question in the chat as well, and that I
bet
just wanted to
that's that
flag.
we're helpful sharing. Okay,
I
cool.
know. I just thought, oh, there we go. We're on to
We're
questions.
at
So
questions.
there was two things that came up.
Okay.
One was, do these same principles apply to an athlete who is returning from a serious illness?
Absolutely.
Yeah.
So injury, we could almost use injury and illness interchangeably, I think, because whether it is, soft or hard tissue injury, or it is an immune system scenario, right? It's a malaise, it's an inability to be able to participate at 100% or maybe even at all. So it could be illness, and illness, it's the same thing. Illnesses can be more, acute and sudden onset, or it could be something chronic that you are learning to live with. And I worked a lot with Paralympic athletes who really do live in that space, in that day to day of conditions that may change. They fluctuate, they're dynamic. They're never going to be completely gone, but it's something that they've accepted, and we're working on that every day. So that is a reality for a lot of athletes as well who've had illness. So
Yeah.
answer 100%. Yeah.
That's great. Thank you. And then the other one that came up a few times was like, what can parents do to support? Because I guess sometimes like they're watching their child go through this
Right.
process. And, I mean, other than watching this and supporting by suggesting some of these techniques, is there anything specific for parents that you wanted to highlight?
Well,
Either of you, actually, Shaunna, but also from your experience, Kyla, as well.
yeah, well, I'll just do a quick answer and then we can go to Kyla. Um, honestly, some of these resources, like giving it a read, I think anyone reading the injury rehab book, for a parent who's going to be like really accepting the reality of, if my child's going to be in competitive sport for the long term, they are going to get injured, right? So how are we going to navigate it as a family? Read Carrie's book. It really helps you from the get-go of how to be the best support person, and also give you some insider tools as a family to use to navigate for your own goal setting as family. So that would be number one. And then the podcast too, it isn't just for the athletes, it's for the families and support members too, to hear how other families, other athletes have navigated, whether it's acute or chronic injury, or applying illness as well. So I would say using the resources and being there, obviously. What do you think, Kyla? Is there anything else that would have really helped you or did help you for family?
Yeah, I think having like bringing or posing the question to the athlete of like how every time
Every time it's over to you, Kyla, and that's cue baby.
how, how can I help you during this time? How do you want me to support you? I know that, taking advice or hearing from your parent is sometimes
Yeah.
challenging, and yeah, so I know that both ways. But I think, yeah, bringing these resources to the table to the athlete, saying like, okay, this is a webinar that I just learned about all of these things, and these are some things you can be doing. Do you want to go over it with me? Should we choose a couple? How are you feel? Like, what is, like kind of asking them instead of more just pushing it on them, saying like, you don't need to be sad, take this opportunity and it's going to be better. And the athletes, like going through
You
an
mean that
identity,
doesn't work, Kyla? What?
an identity crisis. So definitely being like soft in how you're bringing that and just affirming that, it's hard and it does suck and it's going to take a lot of effort, but just that you're going to be there supporting them in whatever they need. Um, and then I think just again trying to bridge that connection between them, um, sick or injured, and team. So that could just be driving to the end of practice. So the player gets hugs or high fives from the team, and like just little things like that. I think can really have an impact.
Absolutely. Yeah, I like what you said about, yeah, you can't force this stuff. I think that it's the being patient as well. Like, I mean, it's already you got to have patience as a parent, period. Like, disclaimer, you have a baby, start building your patience meter, but it really comes in handy when you're watching your child that you love really struggle and suffer through things. So this is just one of those journeys where you are their soft place to fall, but also their cheerleader and sometimes the gentle push as well. So I love that. So do we have any more other questions, Emma?
We
Or
don't. So I think it really just like it's only for me then to thank you both for giving another wonderful webinar on such an interesting topic and such a complex topic. And this was one that came up from our membership in the survey of saying, could you support this side of injury, which I think is probably something that we don't really talk about very much. And it does happen to everyone. So it's a very common experience. So thank you both for sharing your expertise. We will be posting this on our YouTube, as we've mentioned several times, but we will also be emailing it out to those people who registered. And we have our final webinar that is happening in April. And I forget the date, but it is on our website and you can sign up and it will come to everybody who attended with the follow-up email. And it is on the topic of performance under pressure and performance anxiety and basically prepping for provincials because it's just before that, which this topic never seems to cease to draw attention. We've done this a number of times and it's always very well attended. So please sign up for that one. And we will see you next month. So thank you, everyone. Enjoy the rest of your evening.
thank you. Bye, everybody.